Hey everybody. Today we're going to be going over Medicare eligibility. So I'm just gonna kind of go through all the information here. I've got all the tabs opened up here that I thought might be relevant, and just to kind of show you how to navigate everything. And feel free to just go onto these websites yourself to look for yourself if you'd like. But I'm going to be going through all the information here and pausing at certain points to let people, you know, look at the information as we go through it here as well. If you just want to watch the whole video to get the information. So first, um, just type in Medicare eligibility, and it'll take you to this link here. Get started with Medicare. That's probably the best one to click on. It'll take you to this website here and give you several options to click on if you're looking for getting Medicare based off of your age or if you have a disability. Um, so if you are under 65, like I am, you'll want to click this here and it'll take you to this link. Now, like it says here, this is for if you're going to get retirement or disability benefits from Social Security at least 4 months before you turn 65, or if you have a disability like I do. I have cerebral palsy, so um, now the question is, how would you get Social Security benefits before you're 65 in the first place? So, um, I just looked up the question, how to get Social Security income. For me, it's with my disability in particular. I believe with anybody else, it says here you can start it 4 months before you turn 65. Now, if you do have a disability, it will, if you click on this link here, SSDI and SSI benefits for people with disabilities, that will take you to this link here. So this is for somebody that would qualify. Now, um, typically you would get in contact, I believe, with the county board of DD where you live in order to get this process started. They'll connect you if you're not already in their system. They'll get you connected with a caseworker for whoever it is that has the disability, and they'll get the process started for Social Security disability insurance and or the supplemental security income. I have the SSI, and I get that monthly, and that will allow you to also start getting the mm, Medicare benefits as well. Now, I'm just gonna scroll through this real quick. Pause for a couple seconds, let you read through this. Now it says here I want to highlight finding out if you're eligible to get the benefits. This here will tell you if you're eligible for the SSDI, and you can look through that. Just click it real quick, and then take the questionnaire. Let's go back to the page to look at the, and then you can click this to get the steps to apply for Social Security benefits. I'm probably going to be making a video on applying for Social Security benefits specifically. So after we go through the Medicare steps and things like that, I will hopefully have another video out on that sometime soon. So if you want to check that out first. And then eligible for SSI. Just going to pause real quick here for a sec. Okay. And then apply for SSI. It'll take you to this page. So that's that. So say you have Social Security benefits because of a disability or the 4 month period. Now we're going to go step by step through each of these, and I'm going to pause at certain points as we go through these. So click on the first one, different parts of Medicare here. We'll pause for a couple seconds. So Part A specifically helps pay for hospital care. Part B is medical insurance, um, doctors, outpatient things. Um, Usually it'll pay for equipment. I've gone through this process. It does take longer, usually to get some of this stuff, simply because there's a lot of paperwork and step-by-step processes to verify the uh, purchase of the equipment and things like that. Wheelchairs specifically take a couple months. So just keep that in mind when you're trying to figure out how and when you're going to get equipment, things like that. Definitely makes it easier for somebody like me who doesn't necessarily work to be able to pay for equipment and other things like that. But if you need something in a more timely manner for some reason, like if something breaks and it's emergency, it might be worth looking into other avenues to get equipment. I'll be making another video on um, best ways to get equipment outside of insurance and things like that sometime soon as well. So keep an eye out for that. Part D is drug coverage. There's a larger explanation for this later on in the step-by-step thing. So just going to pause here real quick. Just going to highlight this. This part here is important to keep in mind because it might be a little confusing. I still don't quite understand all of the intricacies. I'll be making another video on Medicaid as well. Probably going to be my next video. Okay, so that's that. We're going to go back real quick, go to the cost part. I'm going to pause at intervals to let you look at these. So, monthly premium coverage and part of the costs when you get a service covered. And there's no limit unless you have supplemental coverage. And we can go over that too once we get further on here. So here's Part A costs. That's the hospital insurance. Part B, which is medical insurance. So we'll snip it here. So, like, if you, like me, have limited income and resources, um, I, in particular, have a Medicaid waiver. It's called the Independent Options Waiver that pays for premiums and deductibles and other things like that outside of what Medicare covers. And like I said, I'm going to be making a video on all of that Part D. Let's see. Okay. And there's another little snippet here about limited income again, and we can go over that. Um, Now there's Part C, which wasn't shown in the other part of the um, in the first link that we went to. So the Part C, you choose a plan that you can join, and it is outside of Part B um, premiums. You still have to pay those, and then it'll go over the supplemental insurance, which helps pay for, like it said earlier, things that the Part A and Part B might not cover. Looks like that's the end of that. So let's go back to the beginning again. How does Medicare work? So it says here you don't need to renew signing up every year for the Medicare parts. Makes it easy. You don't have to go through a bunch of phone calls with the um, Board of Development of Disabilities or the state Medicare offices. Um, and then you choose your coverage. They'll send you like a packet. It's usually, I think, 50 pages or so, maybe more, of information on Medicare options that you can choose from, and then they should send you like a paperwork to choose it. Now you don't have to do that; they'll choose automatically if you don't. But it's worth at least knowing about and looking through it at least every once in a while just to make sure. Like it says, it's not private insurance. It's for individuals for the most part. Pause here real quick so you can read through this. I'm gonna highlight each of these real quick. Didn't realize that was a thing. Just gonna pause at each of these sections here as well. Now at the bottom here it mentions end-stage renal disease. That's a tab I have open up here, so we'll look at that here soon. Okay, so next section, step 2, coverage options. So let's talk about original Medicare and Medicare Advantage. So let's click on this real quick to see side by side what they do. So there's more info here, and then we'll go back to that. So it looks like Medicare Advantage is more specific on who they can provide with their coverage, um, simply because it would pay for more of the copays and deductibles and other things like that. Original Medicare would, um, like it says here, you may pay more if your doctor doesn't accept assignment because the Medicare Advantage covers more. I believe what I have is the Medicare Advantage because a lot of times I'll need referrals and other things like that from specific doctors for things such as physical therapy and things like that. Let's go to the next section. All right, let's go back to the page here. Scroll through. Something important to remember: have to get Part A and Part B to join a Medicare Advantage plan. Okay. So go back to the original part here. Go on to the next part of the step 2. Other coverage. How Medicare works with other insurance. So, for example, I am on my dad's insurance because I have a permanent disability. Um, that is usually the primary. And then either Medicare would step in to pay for some of it, or Medicaid, depending on who the secondary is determined to be in the network, or whatever it is that you go through to use these benefits. Could be like a doctor's office, or for example, my PT is different, a different network than the doctor's office now, so they might be two different billing processes. Mm. Mm. This might be worth clicking on here real quick just to take a look at. Looks like it's some sort of questionnaire. If you want to go through and try to answer those questions to figure it out for yourself, feel free. Next step. Looks like it just took us to a website to determine Medicare options. Oh, and perfect timing. Today actually is the first day that you can pick a new plan. Didn't plan it at all. I might just look through this to do mine today or sometime this week. But yeah, you can get started on that now. All right, let's take a look at this highlighted section. Yeah, so I was automatically enrolled into the Medicare when I got my Social Security income um, because of my disability. Same thing with somebody that's getting it right before they turn 65. And I did get the welcome package with the cards and stuff like that, and all the information. Let me click on these real quick just to kind of. Okay, yeah, this is something we didn't go through yet. Looks like it. So I'm just gonna pause each section here for a couple seconds. Okay, next section. It says here, once you signed up for the first time, you can change it within 3 months. Just to keep in mind. Already went through some of this stuff, but I'm just going to pause to give somebody a chance to look through it. Looks like there's phone numbers down here to call. Um, if you have any questions or having trouble reading, understanding some of the information here, or just want more clarification, those lines tend to be a little backlogged, though, so it could be a while before you get a hold of somebody on the day that you call. Let's go back. Check this other one real quick. See if it's got any additional information. Alright. Looks like this is the last step. So we'll just click on each of these and go through them real quick. Now these cards are gonna be probably made out of paper. Um, I believe I still have mine, but it's in kind of a wrinkly, sort of smooshed shape from taking it in and out of my wallet often. Um, so just something to keep in mind when you do get it. be careful with it. Could be easy to ruin or lose if you don't know what you're getting into first. And they all kind of look like this. Right? Mine does. It'll list a number of your basically an ID number for you, and that they'll put into the system, and it'll list out when it starts and ends. I think it's mine was like 2020 or something like that. It says it here. Treat it like a credit card. Somebody can use it to probably steal part of your identity if you lose it. There's not any, identifying features of said person on there besides just that number, like an ID or something. So one of the easier things to kind of spoof for people if they get a hold of it. And for people that are older, you should keep an eye out. Um, they list the specific phone number here. You shouldn't be getting any calls from Medicaid or Medicare or anything like that. You would be calling them if you need anything. Just keep an eye out for scams and things like that. They typically would target older people because they're most of the ones that are going to be in this program. As far as keeping the card and everything, I keep it in a specific spot in my wallet. Um, and I don't take it out unless I need to because, like I said, it's paper, so it'll break down pretty quickly. Just gonna pause here real quick to let you look through this stuff. Next part. And then getting another card. If you lose or something, I did. um, so okay, let's go back. Next part, see if we've gone through this at all here. Medicare services. Now, I didn't mention this before that, but the Medicare Advantage plan, um, since it covers more specific things, and it'll let you basically pick the plan that you get more specifically. They'll send you a card based off of whatever Part C plan that is. So you get a separate card for that. I did. I think that one was made of plastic. So a little more durable. Same thing with the playing card. I think it's similar, if not the same card as this one. It says to bring the Medicaid card as well. I'll make a video on that. And then bring both for supplemental coverage. See here it says there's a Medicare account that you can sign up for to get a new card if you need one. And then there's another number here you can call if if you have other health insurance to kind of finagle the paying for claims and things like that. I had to do that a couple months ago for something. It was a hassle, so might just want to note it down. And figuring out if a provider takes Medicare. Pause for a couple seconds. Okay. Says here there's a mobile app you can get. I didn't know about that. Something to look into to tell what's covered and what's not. Looks like the rest of its information we've already gone over, so let's go back, look at some tips for using Medicare real quick. So there is an account you can make. Let's click on that real quick just to kind of take a look at how to log in and everything. You're gonna need, it says you're gonna need your card first because you need the number and everything. So if anybody wants to take a look at that, I'm gonna pause here real quick just to let you read through this. And the first 3 steps I'll show down there fully, so I'm gonna scroll down a little bit. And then the last one here, health tools. Looks like there's a bunch more resources here actually than other links, so I'm gonna pause a little bit more to give you a little time to look at it and make sure, and you can go onto the website. Save a little bit of time looking through stuff. This one's probably might be the most important one here, really. Depends on the person. Just gonna scroll down a little bit more. Oops, too far. Alright. Now let's go back and just make sure we covered everything. You need email updates down here. If something changes or for some reason, the government shuts down for 2 weeks. You can get some information and keep updated with all that. Now, specifically, it said that this stuff isn't affected by the government shutdown, but it might just be important to do just in case something does happen for some reason. Data breaches or things like that, coverage changes with, federal funding and things like that. So, just something to keep in mind. All right. Looks like that'll be it for. Oh wait, I forgot to go through some of this other stuff. So, if you're over 65, looks like we went through about half of it already with the other one, but I'm just gonna click on these other extra ones. For those of you that are watching this that are over 65, real quick. So, when to sign up. Looks like it's the same questionnaire type thing that we saw earlier. And then if you're still working, while you're 65, some information here. See, this will be kind of relevant to me at least because I'm still on my dad's health insurance. Click on these real quick and pause on them for a couple seconds. health insurance that's not from a job. It'll probably take you to that questionnaire again. Over coverage. If you don't have health insurance, it's just basic. Just sign up. And more information that we already went through earlier about getting more coverage for drug coverage and things like that. And then contacting other entities if you have more questions. Social Security Administration, for example. Okay, let's go back to the other page. Look and see if we missed anything here. Same thing. I'm gonna try to mark these out on the video to make sure it's easier to navigate and everything. Just to kind of section it out for people that are under 65 and people that are over here. So it says here enrollment period starts from the 1st to the 31st each year for enrolling into Medicare. The Advantage plan was October 15th, which is today. Looks like they have other enrollment periods outside of that if you need them. Next part. Retiree insurance. So this is if you're not working, I'm assuming. A lot of it's repeated information, but Looks like we went over most of step 4 already. Let's see if there's any new information here. Looks like there might be a little bit, at least with some of these more specifics on the different plans that you can get for it. So I'll scroll through those real quick. Okay. Right. Looks like we already went over the use your Medicaid parts, so that's it for people over 65. And we're gonna look through the rest of these real quick here. This looks like it's just a page to split up the information a little bit more specifically over the stuff we went through. So I think that should be it for that one. Now the last one here is end-stage renal disease, permanent kidney failure. Okay. So I'm just gonna scroll through these real quick. I'm gonna pause for a few seconds, give you a chance to read through it. And then after this section, I think we're done. Phone numbers here. Scroll down a little bit more. All right, and then there's some resources at the bottom here. All right. Well, I believe that should be it for Medicare. I think we covered everything. And remember, uh, I'm not an expert at this. I kind of just wanted to try to get this information out there as best I could for other people. I learned a couple things through this video. Hopefully you did too. If anybody has any questions for me, feel free to put them in the comments. Like the video, helps spread the video around, and subscribe if you feel like you want to see more videos like this sort of thing, get more information on disability resources and things like that. Thanks, and hopefully I'll be able to get some of the hopefully I'll be able to get some of this video editing stuff better. I'm gonna work on it, see how much I kind of want to put into how much more I want to kind of put into effects and other things like that, and editing the videos and things like that to make them kind of flow better. So if anybody has any suggestions, feel free to let me know. Thanks.